our agenda today, we'll talk about knee pain and particularly arthritis pain that causes knee pain. We'll talk about treatment options for knee pain, including joint replacement, and then we'll briefly touch on hip pain and osteoarthritis in the hip and treatment options for that as well. Just a little background on myself. I grew up in northwestern Pennsylvania. I went to college in Erie, Pennsylvania, which is where I grew up, where I was born. Okay, so again, a bit about me. So I moved to Hershey after I went to college in Erie, and I did a 2-year master's degree. I got my master's degree in anatomy, and then I did my medical degree, again, all at Penn State. And there's branches all over Pennsylvania, and the medical school is in Hershey, so not too shabby of a place to go to school for 6 years. After that, I moved to Boston for 5 years. I did my residency training at the Harvard Orthopedic Program, which is in downtown Boston. We covered all the hospitals in downtown Boston. Again, a great place to live. I lived in Boston when the marathon bombings happened, and so I got to take care of a lot of those folks, and a lot of them are still good friends of mine to this day. So it was a humbling time living in Boston, for sure. After Boston, I moved out to Colorado. Yes, sir?
Oh, okay. No, I was wanted to find out how you got here.
Yeah, I'll get there. So, and somewhere along this serendipitous journey, I met my wife, who is from Deer Park. and so that's why I'm here. But again, grew up in Pennsylvania. So I moved to Colorado, did a 1-year sports medicine fellowship with concentration in hip and knee surgery in Vail, Colorado, and I worked with the U.S. ski team when I was out there. I'm still a team physician for the U.S. ski team, and travel with them around the world every year. And so it's a pretty good gig. And so. But again, like I said, my wife's from Deer Park, so here we are. We can't keep a Texas woman out of Texas for very long. So I practice at All-American Orthopedic and Sports Medicine Institute. It's literally 5 minutes down the road. We have every joint covered at our practice. And so I do mostly lower extremity surgery, do hips and knees and ankles. And between myself and my partners, we do upper extremity surgery, shoulder surgery, elbow surgery, hand surgery. So problems with anything, feel free to stop by. We're happy to help. And so I particularly specialize in hip and knee replacement, sports medicine. I do a lot of ligament reconstruction in the knee. I do arthroscopy of the knee. I take care of traumas and pretty much every orthopedic condition, but I mostly specialize in the lower extremity. Most of the joint replacements that I do here right in this hospital, and that's for several reasons. And so my promise to you as my patient is I want you to have the best experience from the time that you come into my office to the time that you're fully recovered and for the rest of the life of your joint or the surgery, whatever you have. And so that means a cleanly office, you're not having to wait long in the waiting room, your phone calls are attended to, all these things. And so if we do decide that you need a surgery, the next part of that is making sure that you're in a hospital that provides those things as well. Courteous staff, good timing, good service on the floor, and by all means a cleanly operating room with sterile equipment and new equipment. And so this is the building you're sitting in, and this is the operating room that's literally right above your heads right now. And so it's one of the biggest, nicest, newest in the town. And so that's my commitment to you, is that I want to do all this for the benefit of you, which is why I choose to do most of my surgeries here at this hospital. And so today we'll just discuss, again, briefly hip pain and knee pain and some of the solutions that we have for it. And so just a quick test for everyone before we get started. How many people in the United States do you think undergo knee replacements every year? At the current year, what would be your guess?
660.
Yeah, you guys got it, 660. And then disease leading cause of disability in the United States,